Pharmacy electronic records and patient clustering, exploring new ways to increase the provision of tailored pharmaceutical services. Background: community pharmacy collects patient information continuously, creating a permanently updated medication record. This information is kept and stored but remains untapped. Algorithms, queries, and knowledge-based systems are some approaches to screen electronic patient records stored in databases and support pharmacist medication reviews. The aim of the study was to perform a medication review on patients' medication records to identify clusters that will enable the definition of an algorithm to tailor pharmacy professional interventions. Methods: we used a retrospective observational study and a convenience sample of pharmacy electronic medication records. The inclusion criteria used were a 12-month history of continuous therapy between June 2017 and July 2018 and use of 2 or more chronic medications. Drug-related problems were identified according to criteria for necessity, effectiveness, and safety, Beer's criteria, and the degree of severity of interactions and contraindications using CPharma software. Statistical analysis used a two-step cluster to identify common characteristics among patients. Results: 55 patient records underwent medication review. The majority were female and the median of age was 68 years old. 58% of patients went to the pharmacy at least once a month. The two-step cluster analysis identified 4 clusters and 1 outlier, as shown in the figure on the left side. This figure also shows the characteristics found in each cluster and the proportion of patients in each one. On the right side, we can see on the chart the variables used in the model and their importance, and we can see that the most important variable was the severity of interactions. After clusters identification, it was possible to define which pharmaceutical intervention was suited. An advanced medication review could benefit clusters 2 and 3, representing 36.3% of patients. Cluster 1, representing almost 31% of patients, would only need to measure their biomarkers in order to assess the effectiveness of the therapy. The outlier, possibly 5th cluster, representing high-risk patients, would also benefit from a medication review but with high priority. Conclusions: to provide more and better professional services, community pharmacists need tools and systems that can analyze information, processing data easily, quickly, and continuously. The statistical analysis carried out in this study allowed the grouping of patients into clusters, enabling their prioritization and subsequent suggestions of pharmaceutical interventions according to patient health needs. This clustering will provide the foundation for the design of criteria-based algorithm likely to be automated, which will assist community pharmacists in providing better care for chronic patients. Thank you.